the Affordable Care Act was not responsible for all that slowdown in healthcare cost growth. But that is the reality, that healthcare cost growth slowed sharply after Obamacare was passed. So the claim that it's unaffordable, I mean, this is 180 degrees at odds with reality. Cost
Yeah,
growth.
no, absolutely. I think what you're saying, it just points to there being really no evidence that the ACA caused cost increases, right? And it doesn't mean that like everything's so that claim is just unfounded. Like it isn't. It didn't do that. I think when people sometimes cite numbers in cost increases about premiums in the individual market, the big jump in premiums, underlying premiums, happened when you bring a lot more people into the market that couldn't get coverage before, right? That had a lot more health conditions that they were excluded before. So there was a double-digit increase in underlying premiums in the individual market, but that's to be expected. Like that is so. Sometimes we see data, we see the data that you just cited, right? That definitely does not show that there was any cost increase as a result of the ACA. And then it would be misleading to say, oh, well, let's compare premiums from 2012 in the individual market to premiums after, because as we just talked about, the market is vastly different. We're making sure that insurers have to cover people, they have to cover a certain slate of benefits, and they don't have all the ability to limit what they're able to pay on claims because the rules of the road were changed so that we have to make sure that people can actually access healthcare under these plans, and that does cost money.